So my presentation today is going to be roughly half of it is about SPHERE and the work that's been done to date. It's been going for a year and 3 months now, and I'll sort of explain what sort of technology people are working on. And then the other half I'll talk about user-centered design and the study that I'm running at the moment. Most presentations in this area start with a bit of statistics about healthcare problems and the cost of health. And we know that non-communicable diseases are the leading cause of death worldwide. Cardiovascular diseases, diabetes, chronic respiratory diseases and cancer. So this is sort of the context for SPHERE, a system that will perhaps relieve some pressure that currently exists on the NHS, allow for early diagnosis and monitoring of diseases, hopefully. The structure of the project, there are 6 work packages, technology-oriented work packages, environment sensing, so the sensors in the home, light, humidity, temperature, movement, combination of sensors. The vision behind SPHERE is to use existing sensors and integrate them into a single platform. Not to develop new sensors per se, but to create this universal platform. We have video monitoring work package using mainly the Connect 2 at the moment. On-body sensors in work package 3. So work package 3 and work package 4 are linked. Work package 4 is energy harvesting and management, because one of the aims is to make sure that the on-body sensors are as low powered as possible, or that they will be able to harvest their own energy. Work package 5 is fusing all this data, making sense of it, to detect things like activity and behaviour. And then work package 6 concerns the deployment, also the visualization of the data, what's communicated to who and in what form. We then have these activities that run across all 3, and user-centered design is here in activity 3, and alongside it is the public engagement group and PPI, which is patient involvement. Yeah. So we have a SPHERE house set up here. It's a university property, and this is what it looks like. This is the sort of floor plan of the ground floor, and the sensors in there at the moment. So you'll see the environmental sensors from what little circles, and then there are some cameras. Yeah, this is a sort of exaggerated version of the researchers let loose and put as many sensors as they want in there. So it's version 1. This is the type of work that the vision people are working on. So skeleton data to detect movements and extract relevant features to understand what activities are being done, and identify the patterns that might be relevant. This sort of information might work alongside other things like the environmental sensors to locate people and identify people, and also the on-body sensors. So it's very much about integrating the various sensors and not just working in isolation. So the on-body sensor at the moment is the first version is almost ready. I think they're designing some sort of enclosure for it. It's at the moment going to be wrist-worn, using accelerometers, and yes, to detect things like physical activity and localization within the house. And the sort of innovative aspect of this, there are already this type of activity monitors, but is that it will be very low energy, and that it will use harvested energy or transferred energy from the work package 4. So there are 2 things that are being studied at the moment. One is the energy harvesting, things like generating energy from the movement of fabrics and also photovoltaics, so light. Unfortunately, these two techniques do not produce a huge amount of energy. So there's quite a lot of people looking at the power transfer, which would mean having hubs connected to power points in the house, and then have the energy transferred across, or perhaps when you walk by certain areas that you'd have a sort of a burst of power sent to your wearable device. Data mining and fusing, as I mentioned before, information from the different sensors. So how might the cameras and the wearables help predict things like falls in Parkinson's patients? We have partners in Southampton who are looking at this type of information. Other combinations, but at the moment it's about understanding activity from this multiple sensor platform. And work package 6, as I said, is about visualizing the data. This is the dashboard that we have at the moment. The researcher who developed this was going to be here today, but might still turn up. But this is also first version and needs to be tested with users and get some feedback. I think there are ways that it could be improved, but for now we're able to have researchers who are in the house and setting up equipment and running experiments, and we can in the SPHERE offices check what they're doing and the temperature in the house, and so we know that people are in there. So yeah, to sum it up, this is the SPHERE vision, that the house will have all these sensors, cameras and temperature, air quality, certain things like how much TV you're watching and your eating behaviours. It's all very interesting to us as researchers, energy consumption and making sense of it all. But the reality is that people's homes are not as straightforward as something that we can map out and decide things are going here in principle, and the data will be collected and it'll all be relevant. People's homes are messy. This is my living room. They're messy. They have problems. On the one hand, they have problems for the technology. So things like occlusions for the camera, where it can't actually access the data, and too much light is not good as well, because then it can't detect the skeleton data. At the same time, you've got the users' feelings towards having, sensors all around, drilling holes in walls, cables. How's all this going to look in my home? So, yeah. Am I going to always remember to put on my wearable sensor? Am I going to be happy to have the video running constantly? Is all this information going to be accessible to me and stay in the home? And if so, how useful is it? Is it going to be communicated outside the house? And then who has access to it? And I might have concerns then in terms of privacy and other issues, abuse of the system by other people, by third parties. So my work is exactly that, user-centered design, and it's about making sure we understand what people, real people, the people we're meant to be designing for, want and will use. It's not just about accepting the technology, it's about embracing it and making it part of their lives. So yes, as SPHERE researchers, we're very excited about the potentials, and it's very important to keep in mind that people might not want certain things, or they might need to have a gradual introduction to certain kinds of technology. It might not be, we're going to deliver this finished product to you, but we'll introduce things step by step until you get accustomed to it and you realise the benefits of it, and you become more open to the technology. So a user-centered design approach is standardized. This is how everybody will do it. You plan it. But it's about understanding the context of use. It's about going out into the real world and seeing how people live and what technology they use in this case. What are their requirements in terms of the technology, in terms of their health. Then it's an iteration of producing solutions and evaluating them with the users. And then if necessary, repeating the cycle. I think good design always goes through the cycle. You're never going to finish a product because circumstances change, because technology improves, so you can always iterate and make it better. So for SPHERE, we want to make sure that the technology is usable and suitable, also accessible, because we are looking at a range of people. This is meant to be a universal system that not just for older people. Obviously, older people spring to mind. Yes, that would be really good for my mother or grandmother or someone living on their own. But the vision is that this will be a system that people have in their homes and that grows with them as they go through different life stages and is able to give them deliver different functions, if you will, support them in different life stages. So when you're having a baby or having lots of children around the house and you're on your own looking after them, but as well when you've got particular health conditions, older people who might be prone to falls, and also as a means to reassure people that they could monitor their own conditions and understand their own conditions and what works for them and how they can improve it. So the users of this system are not just the people in homes who have the SPHERE system, but also the relatives, because we know that usually they are the first point of call if something does go wrong. Nurses, carers, the clinicians involved in patient care. So we're looking at a variety of things to understand really what all these different stakeholders want from the technology, what experience they have with technology and how this might affect their feelings towards a smart home system, what barriers they perceive and what barriers they actually experience, and how motivated they are. What's their motivation? It might be that for a young, healthy person, they can't see the point of having a SPHERE system in their home. They could see it for, an elderly relative, but not for them. And then how do we motivate people to use it? What added benefits could the system have that are not the immediate health care of a specific condition? All this study needs to happen in real-life context. There's no point in sending out questionnaires and not interacting with people and not looking at homes and different ways people do things. These are all important things. If you're aiming to develop a system that can recognise patterns of behaviour, but people do things differently, then you need to understand there is not a standard way of doing things. There's not a standard number of times that people do things. There's a lot of variability. And how can the system embrace that and work for these different circumstances? At the moment, I'm running an ethnography study. It's been going on since July. This means that I'm going out and meeting people, interviewing in their own homes about their technology and about their health, but also about their feelings towards their home, changes that they've made to their home, changes that they'd like to make, what their role is in all this, if they are people who make decisions, if they are people who make changes. My participants at the moment are divided into 3 groups. One are people who use telecare, so they have some experience of healthcare technology, not the kind that we'd be using in SPHERE, but they're people with a health need, and therefore perhaps a different perspective on healthcare technology. We have households who've had sensors in their home before. One of the project partners is Norwest Media Centre, who've run several studies in the Norwest area with energy monitoring sensors. So these people have participated in these studies and lived with a particular kind of sensors and had feedback from the sensors and changed their behaviour in response to the information they were getting from the sensors. And then my third group, people who don't fall into any of these categories. They are different age ranges, so my youngest participant is 30, my oldest are in their 80s. Different circumstances, so people who are retired and spend a lot of time at home, people who work and are mostly out of the home, families, different issues then that we have to think about within SPHERE. These different circumstances affect people's attitudes to privacy and their motivation to use the technology, as I've said before. So really what I'm looking at is the healthcare and technology in these three spheres, if you will, which is the self, the on-body experience, because we are looking at developing sensors that people will wear, if this is something that people actually want. I mean, it would be great for us if they do wear wrist-worn sensors, but I'm finding from the telecare users that people don't often comply, even though they have the need. There are several reasons why they might not wear their bracelet or their pendant. The home, which is the main focus, because all these participants they live in a home. It's a sort of theme that runs through all of them. And then the community, so who else is involved in their care, or if they're involved in someone else's care, then this is quite interesting for us as well. And how these things affect people's feelings towards their home and their healthcare. So, as I said, I've been doing interviews in people's homes. If we compare this to the photo of mine, this is quite a cluttered environment. To put something like a camera in here might not be very relevant. There are certain requirements for having a camera to make it useful to make the data useful. You need space, you need distance for people to walk and to move, and this is a very small living room. People who are working on the cameras have perhaps not thought about this. They've assumed, working in the house, that things are going to be a certain proportion, or they're going to have staircase. Some houses don't have staircases, and it sounds very obvious, but it does affect how the technology can be used. But also, for me, the interesting part is talking to people and getting their perceptions on what they want, things that we perhaps haven't thought about. So I've been doing these ethnographic interviews and walking tours where people show me around the house and show me the technology that we have and talk about it. And this has been quite effective because when people are holding the technology, they remember the stories about the technology, about how they got it and how they use it, or if they don't use it, why they don't use it. Some people get quite excited and will show me apps that they have, and they've made things for me with the apps and sent them. And this is quite nice because it creates a sort of engagement. The participant is engaged in the research, and I think it creates a sort of openness where they feel able to share quite interesting and quite perhaps personal information, especially when you're talking about health. Another part of my study is cultural probes, which is a design research technique which involves giving people little packs of self-report materials like diaries and cameras and maps, and I've brought a few to show you. I'll show you at the end. And it sort of hands data collection over to them. And it's quite interesting to get the visual representation of their feelings, and actually to leave them alone to decide what they're going to share with you. And you can get some very personal information that they might not have told you face to face in an interview. And then I use these to do a follow-up interview with the participants, and really then unpick, why did you give me this example? What is it about this that makes you feel this way? Or how do you feel about this information? And the last part of this study will be to do some focus groups at the SPHERE House with some of these participants and show them the technology as it is, this sort of first version, and get their feedback on that. So the interview themes, I've now just this morning done the 15 households that I was hoping to get, and we talk about feelings towards the home, and then the technology tool that I mentioned, and then questions about healthcare. I was a bit worried that people wouldn't. How would I talk about health with people? But actually, people are quite happy to talk about health once they get started. A lot of people don't get the opportunity to share their experiences, so they are quite happy to talk about it. And then, yeah, in some situations people don't have health problems, but they are caring for someone else. And then about how these things affect the way that if they had to make changes to their home, if they feel differently towards their home because they've made changes. And then sort of a blue skies question about what they'd want from technology in the future. So throughout this process, it's important to remember that I'm asking people about what they have at the moment, and asking them to imagine what it would be like to live with cameras or a smart home system is very hypothetical, and it's their feelings at the moment, but we can't really say that this is the truth. It's their truth at the moment, but it doesn't mean that's how they will respond to it. So we are quite interested in the next stage to do a study in the house and have people live there. From my point of view, not necessarily to collect data on them. Obviously, I'm part of a bigger project, so we will be collecting that data if possible, but really for people to have the lived experience of being with that technology, and actually use participants from this study who have built this relationship with me and will feel open to say whatever they feel, not perhaps respond in a way they think that I want them to respond and give me the answer they think I want to hear. So, yeah, for user-centered, I'll just sum it up that the user-centered design is really about learning from the users, about the users from the users, and it's important that they're involved from the beginning. It's not enough to develop something in the lab for what we think is appropriate and test it. We might by this point have invested several years and a huge amount of money, only to get back that people don't want it at all, or it might happen that people in that very short period of time will respond, as I said, in the way they think they want the response that you want. And then when you actually try to market a product, it fails because the data wasn't grounded in real life context. So that's the final point.